Hi everyone, today we'll learn about the humerus. The humerus is the bone of the arm. It is longest bone of the upper limb. In this tutorial about the humerus, we'll describe as the features of humerus and the site determination of humerus bone. First, we'll describe the features of humerus bone. The humerus is a longest bone of upper limb. It forms articulation with scapula to form glenohumeral joint and in lower border forms the elbow joint. Humerus has upper end, shaft and lower end. About the upper end of humerus. In upper end there is head of the humerus which is directed medially, backwards and upwards. This head of the humerus forms the articulation with scapula, that is glenoid cavity, to form the glenohumeral joint, also called shoulder joint. The line that separates the head of the humerus from remaining part of upper end is anatomical neck of the humerus. And then in anterior aspect there is lesser tubercle, that is elevation in anterior aspect of the upper end is lesser tubercle, and in lateral aspect there is greater tubercle. In greater tubercle there is impression superior, middle and inferior impression, which is due to insertion of the supraspinatus, infraspinatus and teres minor muscle that forms the rotator cuff. And then there is sulcus, that is called intertubercular sulcus, also called bicipital group between the lesser tubercle and greater tubercle. And the line that separates the upper end from the shaft is called surgical neck of the humerus. Here this is surgical neck of the humerus, whereas this is anatomical neck of the humerus. And about the shaft. The shaft is rounded in the upper half and triangular in the lower half. The shaft has 3 surface and 3 border. About the borders, it has the anterior border, medial border and lateral border. So lateral border, anterior border and medial border, 3 borders of humerus. And a surface is anteromedial, anterolateral and remaining one posterior surface. About the anterior border of humerus. This is anterior border of humerus. In upper half of the anterior border of humerus there is lateral leaf of intertubercular sulcus. In middle part there is anterior margin of deltoid tuberosity. This structure is deltoid tuberosity, and lower part of the anterior border is smooth. About the lateral border. This is lateral border which is prominent at lower end that forms the supracondylar ridge, that is lateral supracondylar ridge, because here is lateral epicondyle, so margin is lateral supracondylar ridge. About the medial border. Upper end of the medial border is formed by medial border of the intertubercular sulcus. Medial leaf of the intertubercular sulcus forms the upper part of the medial border. In a lower part there is formation of medial supracondylar ridge. Medial supracondylar ridge is formed by medial border, lower part of medial border. And about the surface, 3 surface is there. Between the anterior border and lateral border is anterolateral surface, and between the medial and anterior border is anteromedial surface, and posteriorly there is posterior surface. Also in middle part of lateral border there is radial groove. This is radial groove, also called spiral groove. And now about the lower end. In lower end we can describe as, here is the structure, this is the capitulum and this is trochlea. In lower end here is articulating and non-articulating part. These two structure, trochlea and capitulum, are articulating surface. This capitulum articulates with the radius bone, head of the radius, and this trochlea articulates with the trochlear notch of the ulna, trochlear notch of the ulna. And in non-articulating surface, here is medial epicondyle, here is lateral epicondyle, here this is lateral epicondyle, and here this structure is coronoid fossa in medially, and in laterally this is radial fossa and coronoid fossa, and in posterior there is another fossa. This structure is another fossa called olecranon fossa in posterior surface. So we can conclude different features of humerus as, first of all, in upper end here is head of the humerus, and then anatomical neck of the humerus, lesser tubercle and greater tubercle in lateral aspect of upper end, and there is intertubercular sulcus, also called bicipital groove, and then surgical neck of the humerus, then shaft of the humerus. In shaft of the humerus there is deltoid tuberosity, and also here is radial groove or spiral groove, this structure. And in lower end, here is trochlea, capitulum and medial epicondyle, lateral epicondyle here, and two fossa anteriorly. This is coronoid fossa, this is radial fossa. In posterior aspect here is olecranon fossa, this structure is olecranon fossa. This was the features of humerus. And about the side determination of humerus, that is which is right and which is left sided humerus, we can determine by the following point. The first point is upper end is rounded to form the head of the humerus, and lower end is expanded from side to side and flattened from before backward. That is, upper end is rounded to form the head, and the head is directed medially upwards and backwards. Another thing is the lesser tubercle here. The lesser tubercle is from the front of the upper end and is laterally limited by intertubercular sulcus, also called bicipital groove. We can understand about the side determination by the example here. Let's focus on this humerus. Here this is the head of the humerus, and here this is lesser tubercle and greater tubercle, and between them there is intertubercular sulcus. So here it must be left sided humerus, because for the left sided humerus this head is medially and in front there is lesser tubercle. So this is left sided humerus. And in this figure here is head of the humerus directed in this direction, that is medially, and here is lesser tubercle, and lateral there is greater tubercle, and between them intertubercular sulcus. So this head is directed medially, in front of this there is lesser tubercle. So this is right sided humerus. This was all about the features and side determination of humerus.